Hillary Fry has seen her 4-year-old son Reed in situations that no parent ever wants to. Back and forth to the emergency room, admitted to the hospital, intubated, and medevac to St. John's. Reed has asthma. He was prescribed many medications and puffers, but nothing seemed to work until Reed was prescribed Dupixent.
So we started it in January, and the last 2 viruses, he has done amazing. We haven't had to bring him to hospital. We haven't had to initiate oral steroids. This particular drug is costing us $1,100 out of pocket every 4 weeks. So $1,100 per 2 mils of medication.
Reed gets the drug through an injection in his leg every 4 weeks. The family pays out of pocket because the drug is not approved to treat asthma in children under the age of 6. It's what's considered an off-label prescription. The drug is also used to treat eczema, and for that condition, it is approved for use in small children. In other words, if Reed had eczema, his Dupixent prescription would be covered, but since he has asthma, it is not. The family has applied for coverage through their insurance, provincial government programs, Health Canada, and the drug company, but have not been approved.
It's already challenging enough having had gone through that and struggling through managing his chronic illness in a community where, you know, we are limited to what specialty care we can access, and now on top of worrying about how we're going to continue to provide him this medication long-term is tough because it is a long-term medication. My family, you know, is privileged to have resources to shift around, to have the family support, to have the health literacy to access certain services. Not everyone has that. And so for folks who aren't in a privileged position, like, what do? Do they just go without? I don't know.
Despite the cost, Fry says her family will continue to pay out of pocket for this medication, but they are frustrated that they haven't been able to find any solutions and that there are no policies in place to help families in situations like hers.
The policies are very much a one-size-fits-all. They don't take into account, you know, different family needs, location, access to available services. You know, for example, the night that Reed was medevaced out, there was a snowstorm coming. We just made it by the skin of our teeth. And so, you know, the fear of something like that ever happening again, living, you know, in a community where we are limited to certain services, it's scary. And I think that the government really needs to look at their policies and think about making them fit the people and not making people fit the policy.
Hillary Fry has had to take on a second job to cover the cost of her son's medications, and if there are no policy changes, they'll keep paying for almost another year and a half. The family expects to pay around $22,000 between now and Reed's 6th birthday. Regan, CBC News, Happy Valley-Goose Bay.